That was a very bad incident in the sense I was doing my internship and I was not there when my father expired. For 14 days I was not there in doing the internship. When I came back, I was shouted by the professor. He said, 14 दिवस कुठे गेला? म्हटलं मी फादर एक्सपायर्ड. म्हणून काय झालं? सगळ्यांचे वडील वारत नाही का? तुझे एकटेच झाले का? So that time I got a shock. I said, okay, he is an intelligent professor.
But this is shocking.
But this is shocking. In the morning he came into the bike. हे पाया पडलं. Like that. पाया पडून सांगितलं, पाया पडलं. बाहेर लोक गोळा झाली. त्यानंतर डॉक्टर महाजनच्या क्लिनिकमध्ये काय ते होणार. त्यांनी सांगितलं, याच्या पुढे डॉक्टर महाजनवर कोणी हात दाखवला तर चंद्रशी त्याच्याशी आई भाऊ पंगा. लक्षात ठेवा.
Hello and a very warm welcome to all of you in another episode of Emotionally Yours with Pratik. Today we are fortunate to have Dr. Prakash Mahajan with us, who's a doctor, a social worker, overall HIV awareness person who's done multiple things in his life, and we are going to unfold a lot of interesting talks on how his emotional journey has been. So a very warm welcome to you, Dr. Mahajan.
Thank you very much.
Thank you, sir. You can keep it here. Yeah. Okay. So, Dr. Mahajan, first and foremost, I would want to understand that you are a dermatologist turned an HIV doctor turned, a social worker. What exactly has been your inspiration? Because medical studies and social work are not completely related fields, right? So let us try and understand your journey right from beginning, from your medical days, and now you've been in this field for more than 40 years now. How it has been?
Yeah, basically I passed out from BJ Medical College as a dermatologist.
Dermatologist.
And before passing out as a dermatologist, I started my practice as a family physician.
Okay.
Because there was hardly any seats in Pune 40 years back for dermatology. So I started as a family physician. So my practice was a combination of a family physician as well as a dermatologist.
Okay.
So that means I got patients in family practice which are general, right from a baby, from to old people, different variety of patients, different kinds of patients.
Okay.
And as a dermatologist, we had a branch called sexually transmitted diseases.
STD.
Now coming to the late 1990s, when HIV came in India, we were flooded by HIV positive patients in 2 to 3 years.
Okay.
And because it was a sexually transmitted disease, people came to a dermatologist basically. So that's what happened. That's why we were flooded with HIV positive patients, and we were doing work in HIV that time also to educate ourselves to treat these patients. So that's why I started working in HIV. Now HIV. So we gave lectures to so many doctors. So we thought that education of the doctors is first necessary, because I'll tell you an incident where a patient from Yeroda, almost about 15 kilometers from my clinic, he used to come to my clinic just to take one injection daily for 3 months.
Okay.
One day I asked him, why do you come all the way from there? 15 kilometers you have to travel. So he said, not a single doctor in Yeroda is ready to touch me, take me in my clinic.
Because he was HIV.
Because he is HIV positive. And they were just driving me away. I had to come here. You are the only doctor in these 15 kilometers who is ready to take me and give me an injection.
Oh my.
So I thought education of doctors was essential if this particular epidemic has to be contained. So I started taking lectures in different parts of Pune. So I, with my assistant, Dr. Madhu as well, we started lecture series which went on for 2 years. 100 to 150 doctors from Yeroda, then we went to Kothur, then we went to Shivaji Nagar, then we went to Satara and all this. Educating doctors. It was
about
2 days workshops on Saturdays and Sundays, where doctors used to attend. And we used to give them free, all lectures were free. So almost all the areas in the Pune were exhausted. So one day we thought, we are educating doctors. Is the public aware of HIV? So I gave a small advertisement in Sakal, छोटा जाहिराती.
Right, classified.
की तुम्हाला काही त्रास असेल, शंका असतील HIV बद्दल तर तुम्ही फोन करा. And you won't believe it, I was flooded with calls.
Okay.
But we couldn't see a single patient that day. So I thought it was necessary that lay public should be educated. So we actually taught a counselor from NARI, National AIDS Research Institute, about HIV fully. And after 1 month, gave her the phone and she started answering questions. Okay. So 1, this went to 2, 3, then we got a big place, then went to 4, then we went to almost 12 counselors. We were teaching counselors, they are answering the questions. So ultimately we established the Sambhav HIV helpline. And that is how from academics, I gradually come to social work. And Sambhav HIV helpline was the biggest helpline in India for HIV.
Right.
So we started a branch in Patna also. So that is also a very big helpline. We are converting this HIV helpline in Pune to mental helpline. So that's how social work started, and we are fanning out in different directions now. I am working in addictions now. We go to schools, we go to colleges, we go to lay people, tell them about addictions and teach them how to say no in schools and colleges. Somebody offers. So we are working addictions, we are teaching doctors, we are teaching counselors, we are teaching psychologists also in addiction medicine, so that they go into the community, they spread the awareness and they treat the patients as well.
Awesome.
So this is how you asked me about how did I shift from academy to social work.
Right.
So that's how it started. And
Awesome.
we are ever expanding in different directions. We have got a Shala project where we, a dedicated group of our workers from Mukta Charitable Foundation, we established that in 2005, registered with the Charity Commissioner in 2010. And it's a big foundation now. And we are working in, like I said, in Shala project. Dedicated volunteers, they are going to different schools and teach them about Shala beyond books. They are not teaching geography, history like that, but about sexology, about Swachhata, how to say no. So they do that. We have got different other products also at the same time. We have collaborated with Pratham, it's an NGO.
Okay.
And teach, we are training 800 doctors on first aid. And they'll go into the rural area and teach school boys and vulnerable people about first aid.
Awesome.
Like that.
Awesome. When I hear your entire journey about how it motivated you to go for social work and now spanning across not only in HIV awareness but in emotional well-being, mental well-being, or you talk about first aid or various other initiatives, let me take you back to the days when you mentioned about giving a classified advertisement related to HIV. Now during those times, this was more of a social stigma. Even today, it is a big social stigma in the society. So whenever the patients used to come to you, I'm sure there would be a lot of emotional turmoil, emotional battles that they would fight with. And first, you probably had to take care of their emotional well-being at that point, rather than educating them what is HIV and how HIV and AIDS are not synonymous, but they are interrelated. How was your experience?
Yeah, there is a lot of knee-jerk reactions also from the family members. Once a boy tested positive, we had to take care of the emotions of the patient also and the family also.
Right.
And that was a gradual process. We had to consult them, tell them about HIV. Otherwise, the initial reactions in the initial days of HIV epidemic was to just throw out this particular patient. And there were so many dormitories in this area. For example, there was a 40-bedded hospital, rehabilitation center in Yeroda, beyond Yeroda, where 40 HIV positive patients were just thrown out of their homes and they were staying there. And I used to go there and manage those patients, give them treatment, whatever. So every Saturday I used to go there and treatment. That was the situation that time. When people used to die left and right because drugs were not available at that time. So there was a lot of emotional trauma and we had to take care of that. Because that was initially the major work. When drugs came in, all this emotional trauma became less spontaneously. And then that particular, now it becomes a chronic treatable disease, just like diabetes and hypertension and heart attacks.
Correct.
So that emotional trauma is not so much severe as it was in the initial days.
But there is still a socio-cultural stigma attached to it.
Sure.
and
Yeah.
that puts a lot of discomfort in the patients talking about it openly,
Yeah.
right?
Yes, right.
So when you come across certain patients who are not sure whether this is going to be, whether this is the information I should be sharing, whether this is something that my family will accept, whether this is something that the society, my friends would accept. At that point of time, how do you deal with such people?
Well, confidentiality, of course, was shown by the Hippocrates oath.
Correct.
So we cannot disclose his status unless he gives a written or at least an oral consent that yes, she is my wife, you disclose it to her. Otherwise, confidentiality is always maintained, so we don't disclose it.
Okay.
That is one thing. So
For sure.
yeah. And about the family members, you asked me about can you repeat the question?
So my question is, still it is a social stigma. Somebody coming HIV positive, somebody's test results are coming positive for HIV. Okay, there's a lot of emotional botheration people come with. Whether I should talk about it to my friends, my family, they always feel left out, okay, alienated, and they're full of maybe guilt, regret, or any such things because of their sexuality, because of their preferences, because of unsafe sex that they might have ended up with. So at that point of time, how do you deal with patients who are not ready to open up much?
Yeah. So actually, the situation about 2 decades back was absolutely different. Their patient never used to disclose his HIV status to anybody. Come today, this is 2025. I get patients who come with their daughter. The daughter about 25 years. I got about 5-6 daughters who come to my clinic with their father. My father is HIV positive. She declared. There are other patients waiting, but she is not feeling anything about it. The father is also not feeling anything about it. So that acceptance has come into the society largely because of so many things. Because it's not a disease that is going to kill. That is one thing.
There are medicines available.
Yeah, medicines are available. So it is accepted. So that amount of counseling need not be done.
Okay.
It is accepted in the family. It is accepted in the society. They roam about as HIV positive. But of course, this is not true of all the patients. But that shift is taking place. Initially, it was totally a disease where nobody used to disclose anything. Now it is different. They disclose, and they accept the other persons also who are HIV negative in the society. They also accept it.
I have got, I have heard about a few cases where somebody's result was HIV positive and he was getting suicidal thoughts. And then, for him or her, because of lack of awareness or whatever, they felt that this is the end of the world for them. So when such people come in, distress, how do you normally handle such patients?
Actually, that is the reason where we started Samvad HIV helpline.
Okay.
We have got counselors who are trained in counseling, by experts, and they know how to deal with such kind of questions and how to, suppose a caller, we had such cases, says that I'm getting suicidal thoughts and what is to be done. So there is a technique in handling these patients. We are handling that. So this requires real expertise. When such a situation is there, you can't say, no, you are not going to die. Fine. It doesn't work like that. So proper counselors are there who counsel the patients in such kind of a dire situation, like suicidal thoughts.
Correct. Apart from that, the social stigma also bothers them, right?
Sure, that's true.
So society at large is still to accept them as somebody who's probably as normal as anybody else, and who had got this infection from some or the other reason, but now he is going to be all right. When such patients, they are treated and they are absolutely okay, how is their reaction when they go back in the society?
No, actually they are being treated at home.
Okay.
Right? They are not admitted as such, because the illness right now is not so severe.
All right.
It is not so advanced that used to be initially. So there's no question of going back to the society. It is a question of disclosure, basically.
Okay.
If they want to disclose to their family members or not.
So it's still, very much possible that with home treatments, etc., those can be taken out.
They can.
Okay. Now my second, my next question to you is in terms of, emotional well-being or mental health. You started with those helplines. And COVID was a time when people were locked down. There were a lot of spike in terms of, mental stress, distress related cases. I'm sure you would be flooded with such calls related to mental trauma or things like this. What was your experience during those times?
That was a time when we had not yet started mental helpline.
Okay.
Then, because actually we had converted our HIV helpline into a COVID helpline.
COVID helpline.
COVID helpline. And people used to promote that number, and people used to ask about COVID and their mental problems, physical problems also.
Okay. So COVID, from a doctor's point of view, how difficult those 2 years were?
Terrible.
Terrible.
It was terrible from doctor's point of view. Both in terms of being a doctor, continuing the clinic, getting exposed to COVID patients in hospitals, outside the hospitals.
Correct.
So we could shut down our clinics. They were going on. And in terms of patients also, there was a lot of fear, rightly so. And in terms of the patients being isolated, sit at home for 2 years, that's not an easy thing to do.
Yeah.
So those are very difficult times. Very difficult times.
So as a doctor, your colleagues who would get exposed to a lot of infections, I'm sure they would be worried that their families, etc., saying that you're getting so much of exposure out there, and there's a lot of anxiety within themselves that they would carry. Did you experience some of your colleagues or some of your associates not being very healthy in terms of their mental health?
Well, there were a minority few.
Okay.
Majority of the health professionals, including nurses, doctors, they're fighting that war. And there were no resistance as such.
Oh, okay.
I couldn't find any.
All right. So
including my family.
Yeah. I mean, that's the first support that you really need, isn't it?
Yeah.
Awesome. So let me take you to, again, back to the social work that you're doing. Now, you feel that educating masses about, health, well-being, right from, AIDS or HIV to first aid to, schools-related cleanliness, hygiene, etc. And, the hospitals are also sharing this with it. How do you see the future going ahead?
As far as social work
is concerned.
Yeah, as I told you, we are finding out in different directions. Not restricted to HIV. That was a flagship project, Sambhav HIV helpline.
Correct.
Whereas HIV is going down and down. We need to find out in different directions. We are doing that in different directions.
Great.
So there is a lot of scopes. There is a lot of problems in the society which a government agency cannot solve. And that's where an NGO, non-government agency, steps
Is
in.
required. Sir, let me take you to a discussion I was having with somebody from medical fraternity. I understand that whenever you're operating in hospital and critical care, etc., these are the professions, and for that matter, any healthcare profession is very, very volatile in its nature, because there's no certainty about the patient, about the way he or she responds to medicine or surgery or so on and so forth. We've come across various instances in Pune, outside Pune, elsewhere as well, where patients' relatives are outraged when an operation doesn't go that well and there is a death, and they ransack the hospitals, they blame the doctors, etc. Whereas it is very difficult for a doctor to explain the situation, because the patient might have come at a very advanced stage or a very adverse condition, but the doctor tries to do his best. at this point of time, even the doctor's mental health takes a toll, because he or she is doing a job which is very critical, which is very volatile. There is no margin of error in such cases, and yet he or she faces this. How do you see this as an emotional aspect of a doctor?
I think that's where emotional intelligence comes in,
Right.
I view it like this. All this violence against doctors in hospital, yeah, what you said was correct. Patient comes in late, etc., etc. But this emotional intelligence should come in right since the beginning, when the patient enters your clinic. I'll tell you, in my clinic, when the patient comes in, all my 5 senses, except probably the sense of smell,
Right.
those are working. So when the patient comes to you, lie down in the bed, the patient has, let's say, fever, high-grade fever. Nurses will take the temperature, 103 temperature. So my first reaction will put my hand on the forehead. That gives a very comfortable feeling to the patient, right?
More of a personal touch and empathy.
Yeah, the mother is to touch me like this.
Correct.
So patient is calmed there itself. Another sense, my sight. I look at the patient and I realize when I am examining the patient is actually examining me.
Oh, yeah.
He or she is looking into my eyes and asking me whether I can really trust this doctor. And if she sees that there is definitely doctors has got really some want to cure me and not extract money from me, then the patient becomes my trustworthy patient and she has faith in me. Ears, that is third sense. I just ask one question, तुम्हाला काय होतंय? And then keep my mouth shut. I keep my eyes open, my ears open, right? And let the patient talk. Don't interrupt. The patient will tell about the symptoms, that physical symptoms. If you halt, the patient will tell about the emotional symptoms also. And once you touch the heart of the patient, then the patient is faithful to you, right? So all these senses should work together for the patient to have trust in you. Another thing that what's happened in hospital, the sixth sense, that is the common sense, which is very uncommon these days.
Very true.
That is uncommon.
Right.
That is being in hospital. The patients usually mechanically register kara, now their phone number, their call number, they fill in this form, right? Every patient is put into one category. So in my clinic, I've got a variety of patients. One is small child, one is Marwadi, one is a laborer, one is an old person. So there where common sense comes in, how to deal with that particular patient in that particular patient and a particular disease. If you do like this, I think the patient gets attached to you. So in my clinic, I got assistants in my clinic. They won't let the assistant to check them. They say, "Nee, amala Dr. Mahajan pahiye." And now jokingly they say, "You have got a fan club. So these are all your fans. They won't let us touch." So once you develop that rapport with the patient by touching the heart, emotionally touching the heart, then all this kind of violence doesn't take place. That's what my take is. Why this violence? Because you don't touch the heart. You do everything mechanically. That is one major reason.
The trust is not
Trust
established.
is not established. That's why anything mishap happens, then the patient turns violent.
So just explaining that, look, this is what it is. And I'm here to help. But of course, we will try our best. At the end of the day, it is
True.
very uncertain.
Estimating is very important. Yes.
Right. So
when the mind is conditioned to an adverse event like death, that knee-jerk reaction is not there.
They take it in a little better manner than otherwise. Oh, great. So when you talk about emotional intelligence being established, a bond between a patient and a doctor needs to be stronger. Interpersonal relationship is very, very important in terms of connecting with the patient, right? I'm sure you must have got stories where some of your patients are extremely, you yourself felt a little emotional when dealing with such patients. Because the bond is both ways, right? It's both ways. So let us understand a few cases that you might want to talk about. That these were the patients, and I'm so happy that I could really treat them well.
Right, I'll tell you about one incident. When I was a pastor from MBBS, I didn't have money. Father expired.
Okay.
So that was a very bad incident in the sense I was doing my internship. And I was not there when my father expired. For 14 days I was not there in doing internship. When I came back, I was shouted by the professor. He said, 14 दिवस कुठे गेला तो? My father expired. म्हणून काय झालं? सगळ्यांचे वडील वारत नाही का? तुझे एकटेच झाले का? So that time I got a shock. I said, okay, he's an intelligent professor.
But this is shocking.
But this is shocking. So I decided that time itself that I am going to not just practice intelligently, but there should be emotions. There should be some service to the community.
Human aspects.
Human aspects. So I got a job in telco. Good job. Cozy job. Not very hard work. But after 3 months, I left the job because there was nothing in for it. I didn't have money to start a clinic. So I started in a Zopatpatti.
Okay.
Zopatpatti, I started with a small shade. I started my practice there. In Zopatpatti, there is a lot of gundagiri and all those things.
Right.
There was one chap who was the biggest gunda. Out and in and out of jail every time. His uncle died and he blamed me for that. Okay, my uncle died because of you and I am going to kill you.
Oh.
So daily I used to get threatened by somebody. आता एकाने मला सांगितलं की तुम्हाला तो चाकू घेऊन उभा आहे. Like that. How to deal with this? So that was the biggest problem.
How old were you then?
I was about 35, let's say.
Oh.
35. Now how to deal with this? I could have gone to the police commissioner, right? But I knew there was a lot of corruption. He was protected by a political person. Yes. So that was of no use. He got married. That I understood की त्याचं लग्न आहे. आणि माझ्या क्लिनिकवरनं तो जाणार होता तिकडे. त्यांची ती वरात घोडे आणि ऑल दोस थिंग्स तिकडे. So what I did was की त्याला तिथे रथ थांबवला. I came out of my clinic रथ थांबवला आणि he was my greatest enemy. So तिकडे थांबवला. त्याची बायको बसली तिकडे. मी तिला गुच्छा घातला तिकडे. आणि गुच्छा घातल्यावर तो रडला तिकडेच. नेक्स्ट डे मॉर्निंग ही केम विथ हिज वाईफ. हे पाया पड लागलं. ते पाया पडून सांगितलं. पाया पडलं. बाहेर लोक गोळा झाली. चंदर डॉक्टर महाजनच्या क्लिनिकमध्ये काहीतरी होणार होतं. त्यांनी सांगितलं याच्यापुढे डॉक्टर महाजनवर कोणी हात दाखवला तर चंदरशी त्याची आई भाऊ पंगा लक्षात ठेवा. आणि ही बिकेम व्हेरी क्लोज असोसिएटेड फॉर द नेक्स्ट अबाउट 5 to 10 years. So that's how emotionally I got attached to him. He was my greatest enemy. For the next 5 years तो खूप attached झाला तुम्हाला.
Brilliant. So you walked that talk saying that empathy is the single biggest winner in the animosity of human.
Yeah, and I believe that Mahatma Gandhi is saying an eye for an eye will make the world blind.
Very true.
So hitting out against him, he making a war, there was of no use.
Great. So, when you felt, when your professor said those things which are very apathetic in nature, right? Saying that that's okay, your father expired, but so what? Okay? At that point of time when you're studying and you've completed it, I'm sure you must have been very outraged with that thought.
For 14 days, not a single drop escaped my eyes. When he said that, that was the first time I cried.
And then when you converted this gunda into, that's really, really overwhelming. Please. So turning animosity into friendship or a bond. Okay, this is a live example how you connect emotionally with people. Any memories when you started NGO? Because when you start your NGO, there's a lot of interaction with the government agencies that you have to do, right? And government agencies work in their own fashion with their own culture, right? May not have the necessary empathy. Some of them are great. Some of them do work a lot of proactive. They do take things very proactively. But the images, they are not as empathetic as they should be. So did you come across any such experiences where because of non-cooperation or apathy of the government agencies, you had to face roadblocks?
Actually, we are not directly in contact with government agencies as such. As an NGO, we require two certificates. One is called ATG certificate and FCRA. That's our foreign contributions. And when we applied for that, people told us, unless you pay under the table, you are not going to get this. You had to. So, but we as a trust, we are against this. We didn't have any kind of money to pay these people. So we applied and just waited. I don't know, call it God's grace or something like that. One fine morning, we got the ATG without even influencing anybody. It was spontaneous, whatever. Same thing happened with FCRA, which is to be given by the Home Ministry of Delhi.
Right.
So going to Home Ministry in Delhi was a difficult thing. Contacting those people was difficult.
Right.
But again, by God's grace, one fine morning we got that FCRA valid. So you can call it luck, you can call it anything.
But you never
But
encountered.
we believe that if you go on doing good service, God is always behind you.
This will come back to you in some way.
So charity has got a boomerang effect, that's what I believe.
Absolutely.
You give charity, that boomerang is going to come to you in a bigger way. That's what happens.
Beautiful. It's always said that philanthropy is the best way of serving the humanity. Great. Now, when I've read about you in terms of a lot of research papers that you have done. So, from where do you find time? Because I understand that you're engaged in your clinic practice, you're engaged in your social work, you're engaged in your NGOs, etc., etc. A, and B, what have been the major researches on?
See, basically, I have written 4 books.
Right.
That is again a very difficult thing because you have to find time, as you say.
Correct.
It involves a lot of reading, a lot of writing.
Right.
The first book that I wrote from 12 to 3 in the night. I used to come back from my clinic at 11 o'clock at night. From 12 to 3 I used to write for almost 2 years to complete that book. It requires a lot of efforts also.
Right.
And requires a lot of other things like desire, like motivation.
Right.
Or as Abdul Kalam has said, fire in the belly.
Right.
So unless you have that, you cannot write books. See, when I started writing, as I told you, Dr. Madhu also, she was my assistant.
Right.
So I thought, why write a book? I'm not a professor, did it. To write for doctors, books on doctors. So when that motivation was there, you can do it, you can do it. So when that motivation is there, you do it, you find time for that. Otherwise, 12 to 3 is not a time, it is a time to sleep.
Normally in Pune, yes.
So if that motivation is there, then you can turn mountains. That's what I feel. Again, same emotional intelligence comes in there. It is not just the intellect.
Correct.
But you must have all these things.
The passion.
Passion, yes. Otherwise, you cannot write books. So I believed in investing in people, right? And people invest their time in me.
Awesome.
Right? So if they do that, then I can do multiple things. I can run my clinic, and I can write books, I can run my NGO, and there are so many other things also I do at the same time. I was the GPA president. I conducted many conferences. So if you invest in people, then the people will invest in time for you, and that's how it works. Right?
Great.
So
we always say that invest in human capital. That's the best investment that your business can take up. That's what at Quantum we believe in. So we are talking about very similar philosophy. As you rightly said, invest in people. All right? And that investment requires a lot of emotional investment. Okay? Because we talk about real relationships, great conversations, thought-provoking ideas from each other. Somebody would simply come and say, hey, we've been doing all this, but how about starting this? Or we probably are not doing so well in this area. Let us relook and re-engineer ourselves and align ourselves with what needs to be done, right? Any whenever you look back in the entire career, any moments of regret that you have? Or let me put it more than regrets, anything that you felt that could have been better if you would have acted in a different manner?
I don't have any regrets as such. Regrets are not for having done something, but regrets are for not having done something.
Okay.
I should have educated myself more. That's how I always feel. I'm interested in academics,
Right.
day in and day out. So I could have educated myself more in terms of educational qualifications, as well as updating myself academically. Now, as I told you, I'm in so many things.
Right.
So focusing only on academics, it doesn't work.
True.
So if you just focus on academics consistently over a period of years, then you become a professor delegate, which I have not been able to do.
I'm sure in the days to come we would see you doing it. It's only, as you rightly said, you've got that passion to do it. You want to do it. I'm sure in the days to come we will see that delete from your side.
Hope so.
Okay, I'm sure it will be. It's now we are coming towards the end of our discussion. Let me ask you that some of there are various generations of doctors working together, right? Do you see from generation to generation, when you interact with your colleagues from various different generations who are much younger, all right? Do you see any difference in terms of value systems, in terms of the way that they react versus the way you used to conduct yourself in particular situations? And do you feel that there has to be a greater amount of collaboration that needs to be done across the generations of doctors?
One thing I have noticed is because this medical practice is getting industrialized.
Okay, more corporatized.
Yes. And that's why the doctors are becoming more and more mechanical. They follow certain rules which have been laid down by the industries and follow that particular path. That again, same thing. Again, touching the heart of the patient is now, it's in the bygone era now.
Okay.
That doesn't work. They are all mechanical. They promote the clinic. Right? So digital promotion of the clinics is also there.
Right.
So where there's no, actually the patient should come by way of word of mouth, which is not taking place then. It is by the word of advertisements. And when that takes place, it becomes commercial. Then it is money that speaks, not the heart that speaks. So that needs to be changed. We have to go back into that era where doctor was said to be a god. That is no longer there. Now he is taken as a customer and a vendor. That kind of relationship is gradually occurring.
Correct.
And that will ultimately go towards the westernized society of philosophy in medicines.
Right.
I've been to America thrice because my daughter is there. I've seen the system there. It's absolutely mechanized. There
purely
the doctors,
professional.
Yes, doctors are practicing to save their skin, not for the benefit of the patients. They are trying to be perfect, but like the Tower of Lisa, it tilted towards the wrong side. They are making mistakes in a different kind of way. That's what happened.
And again, then there are chances of litigation. There
Litigation.
are
That is what
insurance-related scams. Those come up.
So I told you, they are not practicing for the benefit of the patients. It is for the saving their own skin. Things are going in a different direction, and I think we should not copy paste it here in India.
Okay. Yeah, Indian doctors overseas are still taken up as somebody who's empathetic, who's more concerned about the patient as compared to their Western counterparts. That's primarily because we come from that element where we say that the emotional connection with the patient is the first aspect of every relationship that starts with that particular patient, right? But commercialization, corporatization is maybe important commercially, but at the same time, those are the core values. Those should not be lost.
Sure. totally agree with you.
Okay. Now going further, if you have to really invest in the upcoming generation, okay, who is now graduating as from medical schools, etc., what would be your advice to them?
I got plenty of students in my clinic.
Okay.
Learn from me. Almost 300 to 400 patients. The students have come to me who are now practicing all over Maharashtra. One line I tell them first. Define the purpose of your existence right now when you're passed. You define the purpose of your existence. What are you going to do? Just don't follow the routine. You graduate, start your practice, get married, become old. You define it right now what you're going to do. I give you an example of our Prime Minister Modi. He defined the purpose of his existence and he ran away from his marriage on. He didn't get married. And probably his purpose of life was becoming the Prime Minister. So he defined it that time. Then you can reach heavens. Otherwise it will be routine.
The goal.
You have to define it right now. So by the age of 40, 50, you will have achieved that goal.
As Swami Vivekananda says that, establishing a goal is the first step towards reaching it.
Sure, good.
All right. On that, and that goal would always motivate you, no matter what comes in. There would be difficulties. There would be difficult decisions to be taken. There would be, difficult moments that one encounters. Dr. Mahajan, it was lovely talking to you on various aspects of emotions, connecting with patients from your NGO, from your various initiatives, so on and so forth. We wish you a great road ahead, and it indeed was a pleasure. As a last part of our podcast, we have a tradition where we've got 2 mugs. One, I'm going to sign it for you and give it to you as a memorabilia, and the second one I would request you to sign it for us.
So before we end, I'd like to give us very short statement which I always love as far as emotional intelligence is concerned. The mind has reasons which the head does not know. Sorry, I'm making a mistake. The heart has reasons which the mind does not know.
Awesome. Great. Your turn, sir.
Yeah.
Please sign it for us. Thank you. Give me a minute. We'll hold it like this for the picture. Thank you.